I'm Mabel Jong, and for our final interview of the evening, we have a guest here who is going to talk about drug pricing and the current direction. Dr. Azmi Nabulsi is Deputy Chief Medical and Scientific Officer at Takeda. Welcome.
Thank you.
Thank you for what are your thoughts on the current conversation about drug pricing and what needs to be adjusted in terms of payment models?
My belief that drug pricing needs to be about value. And that was the topic that we discussed at the panel, that value-based care is what need to be the focus here. And the value, although the definition is variable and need to be defined based on the molecule, based on the disease, based on the setting, it has to have the patient as the center for that. What is that a particular medicine is bringing from a value and a meaningfulness towards a particular patient. Mm-hmm. And with that, it has to be an engagement and a partnership between the pharma industry, the payers, and the patients to be able to define it well, assess it well, and learn from the assessment by collecting the right data at the right time and make informed decisions.
Are companies like pharma companies interested in moving in that direction? What are the benefits? They right now work on a payment for discounts too, for a greater number of drugs that are sold perhaps, and you get a discount for that. So why would they want to move to a value-based model?
More and more the pharma companies becoming more sophisticated in understanding that the complexity of a healthcare system and that leading into focus on price actually is hurting everyone. Hence the appreciation that for us to be competitive, we have to bring innovations to patients, and we have to bring innovations that are differentiated. And the best way to be able to do that is to have the opportunity through this partnership I just described to prove that what we bring to patients has value. And with that comes a risk that I believe most, if not all, companies are willing to take.
Mm-hmm. How quickly can we move towards this type of pricing?
It's happening now. And I would say maybe it's happening now at 25% level. I predict, as well as my colleagues at the panel, that within 5 years we'll probably be at 100%. There is significant interest in moving to that. And the more trust and engagement we have at the different level of stakeholders in the U.S. in particular, the more we can move faster. What
were some of the things you learned from the panel that were interesting or surprising to you?
That there is a trust gap, although I sensed that before, but I think it was clear that the trust gap is hindering the progress. There are elements as well of the gaps in the data and appreciation that the quality of the data that needs to drive the progress of this. So the more we improve the quality, the more we'll be able to do these type of value-based contracts and value-based assessments with more confidence. And what surprised me that there is not the right venue in the U.S. at least to bring the patient to the center in those discussions. The good thing, everyone is in agreement that this is what we need to do. The question is, how can we drive this forward?
Mm-hmm. And so what needs to happen for the patient to be at the center of this?
That the discussion have to be more about the value with all of its components, as opposed to the price or a cost of a particular element of treatment. You have to look at the value with all of the components, and that requires research, requires discussions, requires objective assessment based on data.
Dr. Nabulsi, thank you so much for your time today. Really appreciate the opportunity.
Thank you for allowing me to do that. Thank you.
Thank you. And I'm Mabel Jong. Thank you. We'll see you tomorrow morning at 9.